Hi, this is Jamie Beauvais here, and we are going to talk about how we integrated smart tools into our treatment program for Justin here. We got an excellent outcome and pretty quick, so just wanted to discuss how we went about that. So we saw Justin last month, yeah, for a couple weeks. So why don't you tell them what happened, why you came to see us?
I sustained an injury to my left ankle doing CrossFit box jumps. I just came down off of one and somehow rolled my left ankle and ended up on the ground.
Okay. The nice thing about that is Justin came in to see us 10-20 minutes after?
Yeah, about 15
Yeah,
minutes.
so he got in right away, which is great. And at that point, when he came to see us, he was walking pretty gingerly on it already, barely putting much weight on it. The ankle wasn't quite softball big, but it was pretty dang big in 10 minutes. So, what you'll see and what you'll read a lot of time is the PRICE protocol, or protection, rest, ice, compression, elevation. And that's great, but we know that swelling inhibits muscle function. So think about this. You get swelling, your muscles stop firing the way they should. Now you've got a strained skeletal ligamentous system. Your muscles aren't firing, so you have a strained musculoskeletal system, and your brain is not communicating with those muscles and they're not firing. So now you have a strained neuromuscular system and neuromusculoskeletal system. So now there's basically no mechanism of support for that ankle. It kind of sounds like a recipe for disaster. So what we want to do is basically get all these muscles firing right away so that they don't really have a chance to get inhibited and they can protect that ankle. So what we did is we have this set up here where we have some bands around his ankle, really I won't say tight, but supportive around the ankle. And we're going to distract the ankle and have Justin kind of move the ankle to get these muscles firing again. So just put this behind me, kind of under my thighs here. And you just want to pull back until Justin can kind of feel it in there. Can you feel that in there? Oh, perfect. Too much? No. Okay. So what we're doing is we're providing some light distraction at the talocrural joint, as well as we're giving some compression with the bands, almost like voodoo bands. And then after that's there, you just give Justin some resistance to pull, and go ahead and pull straight up. Okay? And so we're working all these muscles, and then you'll want to do however many sets you want to do. Let's go ahead and go diagonal. So yeah, try not to get it from your hip. So up and out, down and in. You want to kind of do this in all different angles so you get all the muscles that support the ankle. Okay, go ahead and take a break. Now I'm just kind of showing you quickly, but you want to do this, and let's go ahead and go up and in, down and out. Showing you this quickly, but you'd want to do this based on what the patient needs and how severe the strain was. Okay. And he can tell you, it gets tiring pretty quickly and you really get those muscles firing. But did it hurt around the swelling that first day that you did it at all?
A little bit.
A little bit? Okay. You want to try to minimize that if you can. Now it's swollen and it's aggravated, so a little bit of aggravation is okay. The benefit outweighs the risk, basically. All right. I'm going to take this off for me. So after we get those muscles firing, we just did some light exercise just to kind of enforce those muscle patterns. And then, thank you. And then what we did was just needled kind of around the swelling and around the muscles. And we used some taping methods where we kind of just put this up on his shin, and then we used all these little fingers, try to spread them out around the swelling to lift the skin, promote circulation, help with that swelling. We kind of went like a basket weave pattern where we put two of these, and then we wove these across each other, and it's pretty effective. So the second visit he came in, you could actually see the little fingers over the swelling where it had helped. Some of the, actually not too bad of bruising for how bad of an injury it was. So when he came in the second visit, he was walking a little bit better, still pretty stiff. And actually, even though this was an inversion sprain, had a lot of tenderness on the dorsiflexors, on the inside of the medial malleolus. So what we did is we used the first we scanned, saw where the problem was, and using the scanner here, so we just kind of went around the medial malleolus, tried to find the areas. He was really tender, kind of along those flexor tendons. And so what we eventually ended up doing, we took the Captain Hook tool, we cleared the path. So I'm giving you the quick and dirty version here. Kind of went around here, cleared everything up. And then what we ended up doing was we loosened up the tissues in between the medial malleolus and the flexors. So we kind of got in here and just kind of went back and forth just a little bit. Okay. It's a little uncomfortable, but not too bad. And then once we kind of cleared up in here, we kind of pinned the tissue, not the flexors, but we pinned the tissue down and had Justin, go ahead and move your ankles up and back. Just like that. And we kind of went in all different directions with this as well. But, thank you. But that seemed to help a little bit as well. Now the next video we're going to talk a little bit about kind of the hidden signs underneath this tattoo, as well as some interesting findings with how Justin walks and how he uses his feet. So that's it for video 1. In video 2 we're going to talk a little bit more about exercises and exercise progression and the interesting things behind this tattoo and where we went from there.